Hello, I'm Peg Bolgioni from Rutland Regional Medical Center, and I'd like to welcome you to Window on Wellness. Our show will be focusing on sepsis awareness, and we will be discussing treatment and diagnosis of sepsis, rehabilitation, and eventual post-sepsis treatment at home. I'll be speaking with several medical professionals from the Rutland Community Collaborative about the process. We'll be back with our show after this message from Rutland Regional Medical Center.
Protecting yourself and others is easy. When you leave your home, wear a mask. When you are near people, stand 6 feet, 1 cow, 3 ducks, 2 dogs, or 5 kittens apart. Sanitize and wash your hands often. When shopping, sanitize your hands and wipe down the cart. Doing these simple and easy things help to keep you and our community safe. Thank you for doing your part. Rutland Regional Medical Center. Healthy you, healthy together.
Welcome back to Window on Wellness. Our first segment is going to be involving Ariane Cameron, who is an RN case manager with Rutland Regional Medical Center. And she's going to be talking with Carol Keefe, who works for the SASH program, but is here in a different role. She has a family member that had been diagnosed with sepsis, and so she and Ariane are going to be talking about the treatment, the diagnosis, and kind of what the next steps will be. So I'm going to turn this over to Ariane and to Carol.
Hi, Ariane. I just recently brought a family member into the ER, and it seems that they were diagnosed with sepsis. What exactly is sepsis, and how does the ER staff identify that they have sepsis?
So hi, Carol. Good questions. So sepsis is actually the body's extreme inflammatory response to an infection, and it could be caused by any type of bacterial or viral infection, most commonly things like UTIs, pneumonia, COVID. Sepsis is important to treat as soon as possible, so we use the acronym TIME for things to look out for in your family members. So TIME stands for T is temperature, which is higher or lower than your normal body's temperature. I is for signs of infection. M is for mental status changes. So if you notice any confusion or things like that in your family members. E is for excruciating pain, the worst pain that your family members ever felt before. So it's really important to treat those symptoms as soon as possible for a better outcome, as sepsis is the third leading cause of death in the United States. Those at risk are those 65 and older or less than 1 year, those with chronic conditions like diabetes, COPD, things like that, or compromised immune systems. We typically treat sepsis with IV fluids and antibiotics, and there definitely are some things that people can do to prevent sepsis, such as taking their antibiotics as prescribed and completing them, not stopping them before they are done with them. Frequent hand washing, good hand washing with soap and water. Following up with your doctor as soon as you don't feel well and it's getting worse instead of better, even though you're maybe taking a medication, you should just reach out to your doctor. Getting vaccinated for the flu is also very important.
Ariane, is there anything that I can take home with me to kind of get some more information about sepsis and maybe even share it with my family member?
Absolutely. So as a community, all the organizations had members come together, and we actually created this sepsis journal here. So this is a journal that we give to family members. It is wonderful in telling you about sepsis, what causes sepsis, the acronyms, what we do to care for sepsis and recovery, including subacute rehab and recovery at home. There's a wonderful page towards the end here where it allows family members to track their vital signs such as their temperature and heart rate and how they are feeling. This we give to them in the hospital on discharge, and we carry it through their sepsis journey into subacute rehab and home, and then they can take it with them to their primary care provider's office to show how they've been doing.
In the emergency room, it was diagnosed that my family member had sepsis. What are the next steps after that?
So we typically admit patients with sepsis, and once their care is completed in the hospital, some patients require additional care, so maybe some subacute rehab to help strengthen them before they get home. So patients attend subacute rehab at facilities like the Pines, to get a little bit stronger before going home. And then the Pine staff, or whichever facility they end up attending, work with your family, you and your family members, to set up home health through visiting nurses or Bayada to help them in the home to continue getting stronger and then eventually living their life as they were before.
I'm at the Pine Skilled Nursing Facility, and I am with Melinda Sanborn, who's the Director of Nursing. And she and Carol Keefe are having an ongoing conversation about her family member that has been diagnosed with sepsis. And they are going to be discussing subacute rehabilitation, which is something that is part of the process for recovery. So I'm going to hand it over to both of them to continue this discussion.
Hi, Melinda.
Hello.
I'm here today because I have a family member that has been diagnosed with sepsis as a result of a urinary tract infection, or a UTI. And it was recommended from the hospital staff that perhaps she go into a skilled nursing facility.
Okay.
And so I guess I'm here to ask, what role does the Pines play in all of this?
Sure. So it sounds like your family member has what we call a urosepsis, which is a septic event caused by generally a urinary tract infection. That's one of the most common forms of sepsis. And is your family member an older person? Generally, that is more problematic for them, and the need for continued care through the skilled nursing facility end is more important for them because of their frailty. They don't handle the dehydration part and such, as well as an adult, younger adult. So we would put your person into our sepsis program. We would evaluate their ability to comprehend and do education, as well as follow the guidelines of the expectations that we would put forth, clinically and through therapy. We would monitor her very closely through our skilled nursing notes that are specific to sepsis. Certain vital signs, temperature, obviously, pulse oximeter, and her heart rate and stuff like that, his or hers. And we'd also put her or him on a hydration program, which is our Cactus program. We have branded that to identify people that are in potential or actual need of hydration. And we monitor their intake and output closely and assure that they are at their optimal health so that they can return home in the best way possible.
And after discharge, what's the process after they've had their time?
So after discharge, and just to reassure you too, as far as the monitoring here, it's not only the clinical aspect that we monitor, but we have an ambassador program. So each department head, and for this person it would be a clinical department head, such as myself or the assistant director, that would follow her stay or his stay here. Every day we go up, how's your stay, how are you feeling, how's your pain, how's your progress in therapy, all of those things. It helps identify things quickly, changes quickly, improvements or decline, so that we can act on it. And we would have a discharge planning meeting once we felt that person is appropriate and ready for discharge, have them pick a home care service of their choice. And then we would obviously, give them our sepsis. That's our sepsis folder there. They would take that home. We would include our notes from here, and then they would have education as to follow up on how to fill out that folder so that their continuum of care can happen at home, and it all flows to the same direction. We make follow-up calls within 24 to 48 hours of them being discharged. That is done by social services, and they ask very specific questions as to their health, depending on what they were here for, and follow-up appointments, and their general well-being, to make sure that they're staying stable and out of the hospital.
We need your help to protect our community against COVID-19. Please wear a mask or facial covering when you are out and about.
Doctors and nurses have been wearing masks for years to protect our patients in the operating room, hospital, and clinics. During this pandemic, we are asking you to do the same to prevent the spread of coronavirus.
Please support the hospital, your community, and each other by practicing social distancing, washing your hands often, and wearing a mask. Rutland Regional Medical Center. Healthy you, healthy together.
The final segment of the program will focus on the sepsis patient transitioning to home after they've been discharged from the skilled nursing facility. Laura Medlin, Community Liaison Nurse from Bayada Home Healthcare, will go over with Carol all of the information that she needs to make sure that her loved one transitions comfortably and safely in their home.
Hi Carol, my name is Laura Medlin. I am the Community Liaison Nurse for Bayada Home Health here in Rutland, and we received a referral for home care for your family member who's going to be going home, and I'm wondering what kind of questions that you have.
Yeah, I'm just wondering, once my family member gets home and home health, Bayada gets in there, what is to be expected? What will home health's role be once they're in there?
So home health typically continues the recovery process that they're going to be doing from the Pines. So we're going to come in with nursing and therapies that have been ordered. Nursing is going to do an assessment on their first visit. They're going to get a baseline on how your family member is doing. And because your family member was in the hospital with sepsis, we're going to use our sepsis protocol and continue the journal that they gave you at the Pines. So nursing is going to they're going to be monitoring all of these things that are in the journal, your heart rate, temperature, and just how you're feeling. But we're going to ask that your family member also continue to track, how they're feeling in this journal.
So what are some of those things that I should be looking for?
So sepsis recovery can take a long time, and it's really common to continue to feel really tired, maybe have some aches and pains, not have a whole lot of energy, poor appetite. So it's important to know that those are normal, but you don't want to see them getting any worse. So there's a little zone guide in here that kind of says some of the things that are normal and not normal. So when you start getting into the yellow, you're going to want to just make sure you're monitoring these things. And then when you get into the red, if we see any of this, we're definitely going to communicate with your physician. But if we're not there and you see any of these things, like a high temperature or increased confusion or sleepiness that's not normal, these are signs that you might want to call the physician. So this is a really good guide to continue to use throughout the recovery process. Our therapists are also going to be in, and they're going to continue the physical part of the rehab. And again, we're going to be doing it at the pace that your family member can really do, because they may still be feeling very, very fatigued. The recovery process, like I said, can take a very long time. And so we're going to put the plan together depending upon how your family member feels they can do. And that can be adapted to anything. On occasion, there is what is called the POST-SEPSIS syndrome. And that, it's not frequent, but it does happen with people who have been really ill with sepsis. And it can have some long-term effects, such as, really bad insomnia, some depression, confusion, and even suicidal thoughts sometimes. So we're going to really be looking for any signs and symptoms of that too, which is something that's really important for the family to keep track of, so that we can notify the physician really quickly if we see any of that.
I do see that they have down here the crisis line for suicide, so that's a nice resource.
When your family member recovers to a certain level, we're probably going to be discharging them from home care services. So it's really important to continue this book for a while, and definitely has a lot of resources. And if there are any questions, obviously call your physician too, but there's also some other numbers in here that you can look up on the computer to see if, some things are normal and stuff. It's a really good resource.
Thank you for joining us on Window on Wellness. Please continue to watch us on PEG TV channel 1075, or visit us online at pegtv.com.